Thank you very much, Anna. It's wonderful to be here and wonderful to see the great audience we've got, and I do hope that these symposiums become a regular feature. I'm talking about what extra things you as patients can do to help your glaucoma. I think we've already established the fact that treating glaucoma is all about lowering the eye pressure. That's just so crucial, and so obviously we need your cooperation. You've got to get the eye drops in every day. If you miss a day, the pressure will go up. You've got to make sure you actually can get the drops in your eyes, and this is something I think we should put more emphasis on, and I spend quite a lot of time seeing how well people can put drops in their eyes and trying to teach them, and we have to accept some people really struggle with this. Punctal occlusion, I don't want to talk about this now, but that's something that you should talk to your eye doctor about. You've got to have regular checks because your glaucoma can be okay, controlled for a number of years, and then suddenly control can be lost. There are a lot of, we talk about secondary glaucomas. You can get glaucoma from all sorts of different causes, but most people have what we call primary glaucoma. It's not due to something else, it's just the condition that you've got. And we believe that this is not due to anything you've done or experienced or caught, but due to your genetic makeup. Lots of genes combining together give you glaucoma. And I guess the assumption therefore is that it's what you've got and you've just got to live with it and try and get your pressure down. But I think that there is more that we can do. And so I'm going to talk to you about diet and lifestyle choices, and these can help partly by lowering eye pressure. We also think that they may alter the blood supply to the optic nerve, and finally they may just help preserve the nerve tissue, because the final pathway of glaucoma is destruction of the optic nerve. Now, this is a minefield because there are studies saying this and studies saying that, and there are many studies that we as eye specialists are very suspicious about. I mean, glaucoma proceeds slowly, and to do a good glaucoma study, you need a lot of patients and you need to follow them for a lot of time. So when we see a study where 45 patients had an intervention and they got a result a couple of months later, we're pretty sceptical about it. And unfortunately, in this area, a lot of these studies are like that. I think health professionals should only give advice when it's based on solid evidence. And so I'm using this red star for the things I'm going to talk about that I think are more valid. On the other hand, when we talk about lifestyle interventions, often these things have other benefits for your lifestyle, and in particular they don't have a downside except maybe cost. So I'm going to talk about some things where the evidence is a bit soft, but on the other hand, there's not a risk. They're not going to do you harm, and maybe they may make a difference. We've gone too far. I think it's important to be aware that some things we do can bring your eye pressure up. Playing wind instruments, the ones where you really have to blow, not the flute. Drinking coffee, standing on your head in yoga, tight neckties, lifting weights, and drinking a lot of fluid over a short period of time. Now, if you just occasionally do some of these things that bring your pressure up, that probably isn't of too much consequence. But if you've got glaucoma that is not controlled and you spend a lot of time playing a wind instrument or doing weightlifting, I think you really want to think about changing your lifestyle. Now, exercise lowers eye pressure, and I think of all the things I'm going to talk about today, I think this is the most exciting and perhaps most important. And the thing is, if you do regular exercise, your eye pressure comes down not just when you're exercising, but all the time. And this effect persists for 3 weeks after you stop exercising. So I think that's something really to think about. There are studies that suggest that certain diets are more beneficial for glaucoma, and basically these are the diets that people are recommending for all sorts of reasons, for you protect your heart, to avoid strokes, and so there are many reasons why you should think about eating vegetables and oily fish and so on. I just put this in to sort of give you a feel for the idea that there are all these studies out there, and some say one thing and some say the other. So high BMI basically are people who are overweight. These people have higher pressure, but they have less glaucoma. So we don't really know what's going on with that. There's been talk about nutritional supplements for a long time, and I think most eye specialists have been pretty sceptical about these, but this year a big review of papers came out, and there have been a lot of more recent studies, and this review covered 33 different trials, and I think we have to start taking some of these things seriously, and I've picked out a number of these agents that you just might want to think about. So the best evidence is for Ginko, and this has been around for a while, and Ginko comes from the beautiful Ginko tree. I passed a tree that looked like that just the other day, but this is a herbal extract where there's quite a lot of evidence that it can be beneficial for glaucoma. Forskolin was a new one to me, and this is from an Indian plant that I have shown you. There's a picture there, and this is a traditional herbal medicine. Now, as well as the fact that there are studies suggesting this is helpful, this makes sense because we know that this drug, it's not, we try and not use the term drug, but this chemical does have effects on our metabolism that there's a logic behind the fact that it could be helpful. Here's another one that was new to me, and again there is evidence that this affects our biochemistry in a useful way, and apparently this herbal medicine has been used for chronic pain and inflammation for quite some time. So there's a group of chemicals that give colour to fruits in particular. And there's a long use of bilberry being used as a alternative medicine, and most eye doctors have been pretty dismissive about this because really the evidence hasn't been there, and but there are more recent trials, and we are starting to get some evidence that maybe we need to bite our tongue and be less sceptical about these agents. Another herbal plant, this is a traditional Chinese medicine. So these are my recommendations. Certainly there are many reasons to exercise. It's good for mood, it prevents dementia, it's certainly good for your heart, and it may well be very helpful for your glaucoma. A lot of the other advice really comes down to leading a healthy life along the lines that we should do to prevent dementia and to prevent heart attacks, and I think we should all be thinking about these things. If you drink a lot of fluid over a very short period of time, that will push your eye pressure up, so it's probably best not to do that. I think you need to think about how much coffee you drink. In one study, it suggested more than 5 cups a day was really going to be unhelpful. I'm not saying that we should all immediately stop drinking coffee, but perhaps in moderation. I didn't talk about blood pressure, but it's important you control your blood pressure, but in glaucoma you don't want to have your blood pressure drop too low at night time. And so think about these things of lifting weights, playing wind instruments, your yoga, tight neckties. And finally, I do think, in particular, people where the glaucoma control is challenging. I mean, if your glaucoma is controlled and every time you go along and see your eye doctor, they give you a pat on the back and say you're doing well, well then these things probably aren't so important. But I think they're really important if you have low eye pressure, you're taking your medications, but your doctor is concerned. Things seem to be getting worse, even though you're following all their instructions. That's really when I think you should seriously think about taking things like Ginko, and now we've got a slightly longer list. So there's some food for thought, things that you might want to do to work alongside your doctor's treatment. Thank you.